Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am a doctor of chiropractic and a certified personal trainer. Today I'm going to speak about tendon injuries, specifically for weight lifters age 55 and above. Tendon injuries can happen at any age. We want to lower the risk of the development of tendon injuries, and we want to treat them properly. Tendon injuries can be very frustrating. They can be recurring. They can be persistent, meaning they can last a long time, and they can be painful and performance limiting. So you want to do everything you can to lower the risk of the development of a tendon injury. Tendons are strong, flexible bands of fibrous tissue that connect muscles to bone and transmit forces. Tendons respond to loading. Tendons are adaptable, but they adapt slower than muscles. Injuries to tendons can be persistent, long-standing, and recurring. Tendon injuries are very common. The most well-known are tennis elbow, which is named lateral epicondylitis in medical terminology, patellar tendinopathy, and Achilles tendinopathy. But a numerous amount of tendinopathies exist. These include, but are not limited to, triceps tendinopathy, which is very common among weightlifters, long head of the biceps tendinopathy, pectoralis minor insertion tendinopathy, which is also known as bench presser's shoulder, thumb tendinopathy, medial epicondylitis, which is nicknamed golfer's elbow and climber's elbow, proximal hamstrings tendinopathy, peroneal tendinopathy, and rotator cuff tendinopathy. Terminology of tendon conditions. Oftentimes, the terms tendinopathy, tendinitis, and tendinosis are used incorrectly or interchanged with one another. In the past, I was guilty of this common mistake. Here is the correct terminology. Tendinopathy is a disease or a disorder of a tendon. Tendinitis is inflammation of a tendon resulting from microtrauma caused by a demand that is too heavy or too soon. Tendinosis, degeneration of a tendon's collagen fibers due to chronic overuse. Continual usage combined with inadequate rest results in tendinosis, not tendinitis. The main symptoms of tendinopathy include pain, often described as a deep ache, tenderness, soreness, pulling, and tightness. Localized swelling may be present. In tendinosis, the symptoms have an insidious onset, while with tendinitis, the symptoms can begin suddenly. Pain increases with repetitive activity. Symptoms are usually aggravated by active and resisted contractions of the muscle and passive contractions of the opposing muscle or muscles. Initially, the symptoms of tendinopathy are felt only after activity. As the condition worsens, the pain will occur at the commencement of activity, then disappear, only to return after the activity. If left untreated, the symptoms will progress to a point where they are felt constantly. Tendinosis is an overuse injury caused by the cumulative effect of repetitive loading. Overtraining is the first and foremost extrinsic contributing factor. Signs to determine if you are overtraining. Overtraining is often defined as doing too much too soon. The signs include too much soreness, long-standing soreness, feeling strained, localized pain, tenderness, swelling, and redness. Common extrinsic sources of tendinopathy are sudden increases in training intensity, volume, and duration, improper warm-up, inadequate rest between training sessions, and improper lifting technique. Common intrinsic contributing factors of tendinopathy are strength imbalances and vitamin and mineral deficiencies. Several studies have shown a correlation between vitamin D deficiency and tendon injuries. Vitamin B12 deficiency results in interference with collagen cross-linking, which may affect tendon integrity. Injury prevention is easier, faster, and less expensive than injury rehabilitation. To lower the risk of a tendon injury, formulate a training routine that builds symmetrical strength around the joints. Develop a training routine that includes adequate amounts of rest and recovery. Increase intensity in small, gradual, calculated increments. Progress slowly. Warm up thoroughly. Cool down after training. Perform scapular stabilization exercises and utilize multiple training variables. Utilize concentric, eccentric, and isometric exercises to lower the risk of tendon injuries. Younger, more conditioned athletes can also utilize plyometric exercises. If an exercise elicits or intensifies symptoms, stop immediately. Modify the exercise. If the symptoms continue, stop the exercise immediately and use a viable substitute. If symptoms begin, please see a medical professional. You can see a doctor of chiropractic like myself, or you can see another type of medical professional. Do not self-diagnose. Tendon injuries are common among weightlifters age 55 and above. If you start to experience symptoms, please see a medical professional. You can see a medical professional like myself, a doctor of chiropractic, or you can see another type of medical professional. Do not self-diagnose. As a doctor of chiropractic, I have seen numerous cases of tendon injuries. All of the types of tendon injuries that I described or named in the beginning of this video, I have treated in my office. Many of these injuries are common among weightlifters. Chiropractic care helps to restore the proper nerve flow, and it helps to restore proper skeletal motion. Also, muscle work can be performed and stretching exercises can be performed. So please see a medical professional. Like I said, you could see a doctor of chiropractic like myself or another type of medical professional. Once you have seen a medical professional and have gotten your diagnosis, you can start treatment at the medical facility and you could start your self-treatment. Obviously, you want to make sure that your treatment is approved by your doctor. I should say your self-treatment is approved by your doctor. Formulate a plan. Work with the medical professional. You could perform self-massage. You could perform stretching exercises. You can get a medical massage to help with these types of injuries. Most likely, you will be able to perform some type of eccentric exercises. Eccentric is the medical name for the negative portion of an exercise. This may help to strengthen the muscles and the tendon without putting additional stress on the tendon. Obviously, like I stated before, you want to make sure that it is not eliciting or intensifying symptoms. If it is, you want to stop immediately. You can wear a brace around the affected joint to help to lessen the stress and the pulling where the tendon attaches to the bone. You can also use a joint sleeve. This will help to provide a little bit of stability and warmth to the joint while you are training. Lifters age 55 and above, really all lifters, tendon injuries can be painful, persistent, and they can affect your progress. They could slow down your gains. Utilize the suggestions that I provided in this video to lower the risk of the development of a tendon injury and to self-treat a tendon injury if symptoms should occur. Again, please see a medical professional. Do not self-diagnose. Develop symmetrical strength around a joint. Do not overtrain. Give yourself adequate rest between training sessions. Get adequate sleep every night. Eat healthy. Take the supplements that you need. Supplementation is on an individual needed basis. So figure out what you need to take and take the correct amount of a good quality supplement. The best supplements are derived from certified organic whole foods. So do these suggestions and lower the risk of the development of a tendon injury, and also to help yourself to recover from a tendon injury. Thank you everybody for watching today's episode. Lifters age 55 and above, and really all lifters, continue to train hard and to train smart. Have fun in the gym. Develop a plan that works for your individual needs. Get adequate rest between your training sessions. Get a good night's sleep, which is extremely important. Train hard and train smart. Utilize nutritional strategies and supplementation strategies that work for you. And go out there and accomplish all of your goals, not only in the gym, but outside of the gym also. Everyone, keep up the good work. Thank you for watching. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comments section below, and please subscribe to my YouTube page. Thank you again.